If you have to raise your voice to be understood as a result of noise on site, stop work and raise the problem with your supervisor. Always wear the correct protection in a hearing protection zone. Exposure to vibration is a serious issue as it can result in disabling health conditions that cannot be cured. Hand-arm vibration syndrome, HAVS, includes a range of conditions that can lead to permanent damage in the hands and forearms. Regular use of handheld tools and equipment that vibrate is the main cause of hand-arm vibration syndrome. Your employer should explain safe methods of use and give you advice on exposure times for handheld vibrating tools.
How can excessive noise levels affect your hearing? Give 2 answers. Hearing improvement, ear infections, permanent hearing loss, temporary hearing loss. What are the signs and symptoms of noise-related hearing damage? Ear infections and regular headaches. Nausea and a skin rash around your ears. There are no signs or symptoms associated with hearing damage. Difficulty following a conversation, especially against background noise. If you hear a ringing sound in your ears after working with noisy equipment, what does this mean? The noise level was high but acceptable. You have also been subjected to vibration. Your hearing has been temporarily damaged. Your hearing protection was working properly. Can the damage by exposure to noise over a long period of time be reversed? Yes, if you change jobs. Yes, if you have an operation. No, the damage is permanent. No, unless medication is used. What is the main risk to this worker wearing only these items of personal protective equipment, PPE? Dermatitis to skin. Damage to hearing. Eye injuries. Breathing in harmful dust. What should an employee do if they think noise at work may have damaged their hearing? Take time off work as they are unwell. Nothing, as the damage has already been done. Ask their employer or doctor to arrange a hearing test. Plug their ears with cotton wool to stop any more damage. What is the main... Your doctor tells you that you have hand-arm vibration syndrome, HAVS, possibly caused through work. What should you do? Tell no one, as it's not contagious. Only inform your friends at work. Inform your supervisor or employer. Tell no one. What are 3 early signs of hand-arm vibration syndrome, HAVS? Rash on the fingers. Fingertips turn white. Blisters on the fingers. Temporary loss of feeling in the fingers. Tingling or a pins and needles sensation in the fingers.
Which one of these tools is the most likely to cause hand-arm vibration syndrome, HAVS, HAVS? Handsaw, hammer drill, hammer and chisel, battery-powered screwdriver.
What health problem can be caused by using handheld vibrating tools? Blisters on your fingers and hands. Skin cancer on your hands and arms. Damage to the blood vessels in your fingers and hands. An itchy skin irritation like dermatitis affecting your hands. What health problem can be caused by using handheld vibrating tools? Blisters on your fingers and hands. Skin cancer on your hands and arms. Damage to the blood vessels in your fingers and hands. An itchy skin irritation like dermatitis affecting your hands. You are less likely to suffer from hand-arm vibration syndrome, HAVS, if you feel which one of the following: cold but dry, cold and wet, warm and dry, wet but warm. You have been using a vibrating tool and the ends of your fingers are starting to tingle. What does this mean? You can carry on using the tool, but you must hold it more tightly. You can carry on using the tool, but you must loosen your grip. You need to report your symptoms before they cause a problem. You must not use this tool or any other vibrating tool ever again. What are 2 recommended ways to protect your hearing? Earplugs in your ears, ear defenders over your ears, soft cloth pads over your ears, rolled tissue paper in your ears, cotton wool pads over your ears. Noise levels may be a problem if you have to raise your voice to be heard by someone standing how far away? What does wearing hearing protection do? Helps you to hear better. Repairs your hearing if it is damaged. Stops you hearing all noise in the workplace. Reduces damaging noise to an acceptable level. If you need to wear disposable foam earplugs, how should you insert them so they protect your hearing from damage? Do not roll or fold them and insert them halfway into your ear canal. Fold them in half, pull on your earlobe and wedge them halfway into your ear. Soak them in water, squeeze them out, and then insert them into your ear canal. Roll them up and insert them while pulling the top of your ear up to open up the ear canal.
What should you do if you need to wear ear defenders but an ear pad is missing from one of the shells? Leave them off and work without any hearing protection. Put them on and work with them as they are. Do not work in noisy areas until they are replaced.
Using a grinder whilst wearing this personal protective equipment, PPE, could result in which of the following? Lung disease, Weil's disease, hearing damage, eye injuries. What should you do if someone near you is using noisy equipment and you have no hearing protection? Speak to the other person's supervisor to stop them making the noise. Ask them to stop what they are doing as it is disrupting other workers on site. Carry on with your work as you are not the person using the noisy equipment. Leave the area until you have the correct personal protective equipment, PPE. How can you help reduce the risk of hand-arm vibration when using a vibrating tool? Hold the tool more tightly. Use more force on the tool. Hold the tool at arm's length. Do not grip the tool too tightly. How can the effects of hand-arm vibration be reduced if you are using vibrating tools? Complete the job in one long burst. Only use one hand at a time on the tool. Do not smoke as it affects blood circulation. Hold the tool as tightly as you can and work quickly. What risk does this worker face by using this tool on a regular basis? Dermatitis from repetitive use. Weil's disease caused by the dust. Hand-arm vibration from prolonged use. Heat and what do the initials HAVS stand for? Hand-arm vibration syndrome, hand and ventilation system. Heavy arm vibrations. Which two potential health issues are more likely when using a hammer drill for long periods of time? Carpal tunnel syndrome, vibration white finger, hepatitis, head injuries, speech impairment,